Are there any natural options in helping your child with ear infections? Do antibiotics even work? Are they even safe? Hi, I'm Dr. Jason Day with Trinity Life Center here in Holly Springs, and today in this video about ear infections, we're going to be answering all of those questions. What are ear infections? Well, we know they're very common in the pediatric population. They're absolutely devastating for a child. They're very painful, and it's very painful as a parent. I'm a father of 4 to see our children have pain. So what are we going to do about these things? Well, first off, we're going to tackle what causes ear infections. Ultimately, ear infections are 2 things, a plumbing issue and an immune system issue. Believe it or not, it's not caused by a lack of antibiotics in the bloodstream. Our brain and our nerve system are running the show in every aspect of our body, especially in the immune system. Sometimes with kids during the birth process, that nervous system can be damaged or disconnected. Think about the normal birth process, how challenging that is for a mother. But let's think about the little kid coming from this perfectly serene environment into this chaotic world. A lot of times, the average C-section, this is straight from medical literature, puts upwards of 60 to 90 pounds of pulling on a baby's neck. But what are they pulling on? It's not just the neck, it's not just the muscles, it's the brainstem. The top bone in the neck is called the atlas, and we're going to circle back to that and why that may be playing a critical role in your child's ear infections. We said it's a plumbing issue. Now, one of the old wives' tales, and sadly one of the old pediatricians' tales, is that kids or babies get more ear infections because their eustachian canal, or tube, is a little bit flatter. Well, let's think about it. How many babies do you know are walking around? How many babies are upright? The fact that it's flat is actually perfectly designed. They're laying on their backs or their sides most of the time, so they need a flatter canal for better drainage. But all of that entire argument hinges on the absurd idea that things move through the body because of gravity. Now, when I swallow my food, it doesn't tumble through my throat and down through my gut and finally gravity pulls it out. If I'm drinking water, it's not falling down into my stomach. I have blood in my feet right now, not because of gravity, but because my heart pumped it down there. Your child's eustachian tube, the area where it's so inflamed and irritated with ear infection, is no different. There's a specific muscle, and I want you moms out there to look this up. It's called the tensor veli palatini. Sounds like an Italian word, but it's a very important muscle that actually attaches to the base of the skull, as well as the atlas, as well as the palate. Now, this muscle, very small in size, but it actually plays a critical role in pumping that tube. Every time your child or baby suckles, coos, talks, moves that jaw in any way, that donut-shaped muscle is pulling that tube. Now, you can imagine if they're moving, talking healthy, that tube is going to be pumped. But what happens if that top bone in the neck gets pulled out of alignment? Now we've got some issues. No longer is that muscle going to be pumping, it's going to be stiff. Just like when you have a bone out of alignment in your back muscles are going to be stiff. So now that eustachian tube is no longer pumping, we created a dam. And just like that puddle in the corner of a bathroom, if it's left to sit there, that becomes a cesspool of bacteria and virus. Medical literature tells us that most ear infections are actually viral in nature. But yet, the #1 prescribed medications for pediatrics, guess what? Antibiotics. Now, when I was just a little child in the early 1980s, pediatricians, not chiropractors, but pediatricians overwhelmingly agreed and asserted that antibiotics not only do not help with ear infections, they actually set the child up for immune system failure in the future. Did you know that 70+% of our immune system is where? It's in our gut. Now, if I said, where's our heart, where's our liver, where's our lung, we could all point to those. But a lot of people don't realize that our gut is the home of the immune system. What happens when you take antibiotics? What happens to your baby when they take antibiotics? Yep, they get upset stomach, and for good reason, because we're killing off all the bacteria, not just bad bacteria. Actually, the only thing that kills good bacteria is bad bacteria, but with each round of antibiotics, we're wiping the slate clean, and ultimately wiping their immune system clean. Check out the medical literature. Kids that take multiple rounds of antibiotics, they don't do too well with asthma and allergies down the road. So the next line of defense, once the pediatricians decide that those 10 rounds of antibiotics didn't work and the kid's still screaming, let's put in tubes. The tubes actually don't prevent infection. They don't help infection. They don't heal infection. They actually drain infection. But where are we draining the infection? Not out of the body, but down into the throat. What's right here? The adenoids. Now the adenoids are getting swollen, the tonsils. One of the most popular surgeries in pediatrics all today is tonsillectomies because we drained the infection down. We haven't helped the infection, we didn't help the immune system. In fact, we probably destroyed it, but we're creating more infection for this child. Once the tonsils are taken out, guess what? We've got more room to drain down into the upper respiratory areas. Check out the connection between tubes, tonsillectomies, and asthma and allergies. Unfortunately, the treatment for asthma and allergies is steroids. No one in their right mind, including doctors, should recommend steroid use for the rest of their life. We know when athletes use steroids, it leads to heart issues. Kids puffing on steroids is no different. Don't get me wrong, I'm not anti-medicine. Thank God for antibiotics when you need them. Thank God for these steroids when a child is having an asthma attack. But long term, we're setting these kids up for failure. How does chiropractic fit into this puzzle? Well, chiropractic is a very gentle and specific adjustment, not just to the bone, but to the nervous system. The nervous system and immune system are totally intertwined. When the nervous system gets overwhelmed and stressed, that's when the immune system starts tanking. I told you earlier in the video that ear infections are actually a plumbing issue and an immune system issue. When you have a misalignment to that top bone, remember that crazy named muscle? Well, now we've tightened that muscle. The plumbing is completely off. Now the immune system is starting to tank because the brainstem and the vagus nerve are irritated. We've got a child in a complete tailspin of immune system failure as well as plumbing failure. Ear infections are all but a guarantee. And now we put them down the path of antibiotics and God knows what else. What chiropractic does is we very gently and specifically remove these irritations so that the body can fix itself. A chiropractic adjustment for your baby is about the pressure you would check the ripeness of a tomato. It's very gentle, it's very specific, but in one fell swoop, we're not only giving a huge boost to that immune system, but we're improving the plumbing. Our turnaround time on the healing factor with these kids is radical. It's amazing to watch because you take this child that's hurting so much, this family, and honestly parents that are hurting so much to have to watch this and see this huge turnaround. When it comes to your child's health, we don't guess, we measure. We have the most state-of-the-art, cutting-edge technology that objectively measures if your child even has these neurological irritations that open the door for these ear infections. By removing those irritations and first off starting off knowing that they're there, we can truly help your child. If this video has been of any benefit to you, or if you know somebody out there would benefit from this information, tag them in the line below so that they can connect with us and connect with a better future.